practice. So that way we have that one later. Okay, we talked about EKV. So I'm just going to do an EKV scan now just by clicking on that and doing a quick scan. It's only about 10 seconds, but we're going to get a really high, clean, smooth image of a beating heart. So we're almost done. And actually, you can see little pixels in here, and that's just blood circulating in the heart. So that's the type of resolution we're getting with that type of scan. Okay, so we'll save that. And I think one that's kind of nice to do for presentations is if we did a color Doppler scan over this heart and EKV together. This will take a little bit longer, about 15 or 20 seconds, but you'll actually be able to see, I don't know if anybody does MI models in your groups. So you'll be able to actually see a thinning of that wall, and you'll be able to see pooling of blood down there. So you wouldn't actually have that nice ejection that you do in a normal heart. So another couple seconds and we'll be there. It's also a nice way to visualize the coronary artery coming off the aorta by using color and color EKV. So I need to adjust the thresholding a little bit, and we'll process it. And we can get rid of some of that background. And you can actually see that flow in the heart, right? So we can threshold a little bit more to get rid of some of that excessive coloring, and now we're actually just seeing a lot more information, right? So again, something that's at this point not quantifiable, but for a presentation or if you guys do MATLAB, Python, or R, all that data is in there. It's just a matter of teasing it out if that's something you wanted to do. So if I go to my Measurements tab and click on Auto LV, it'll do an automatic trace for me. And it's telling me my ejection fraction right now is 43, and it's already done on 1 cardiac cycle. If you go into settings, we can actually change that. So if you wanted to do 3 cardiac cycles and average it, I can show you how to do that later. Okay. So we'll go save that and do a scan. So from here, from a long axis, the next thing we're going to do is a short axis. So all I'm going to do, I had talked about those notches earlier. So if I take this transducer and turn this 90 degrees clockwise, I can actually feel when it hits in that 90 degrees, and I should have a pretty good short axis image. And these 2 white spots right there, if I play this slowly, those are my papillary muscles. Ideally, they'll be at 2 and 4 o'clock, which they're pretty close. If they're not, we can adjust that by taking the stage and tilting it so that way the transducer comes a little bit farther around the side of the animal. But we're just going to save this for now. Go back to our live scan. We're going to go to M mode. We talked about motion mode. I'm just going to click on these balls outside these horizontal lines and drag it so that they're just outside the walls of the heart, and then hit start, and then we'll see your LV. So let me just make this a little bit brighter. So this is your anterior wall, or sorry, your posterior wall here and your anterior wall. So we can actually do an auto LV analysis on that, and from that it'll calculate LV mass. Okay, so we're going to save that. While we're here, it's a really easy acquisition to do pulmonaries. So do we want to do that now, or are we going to save it for the afternoon? Does anybody care about pulmonary artery?
Yes.
Okay, so to do pulmonary artery, all we're going to do is take our Y knob, and we're just going to turn it clockwise and bring the animal towards us. And when we do, oops, not enough, of course. Some black line right here, and I want to bring it a little bit further so we can actually see. Okay. If I put color on this, so this blue, blue is away from the transducer, right? And we actually have a branch here and a branch here. So this is my main pulmonary artery, this is the left, and that's the right. So if we wanted to do a velocity measurement in here, we just go to pulse wave. I had told you we're going to use that color overlay to be able to identify where we want to put our gate. So you actually see this light blue spot, that's your area of highest velocity. So we're actually going to put our gate right on there. We're going to adjust the angle to be in line with flow. and we'll hit start. It's going away from the transducer, so it should be negative. We're just going to slide our baseline up. A high velocity vessel should have a nice white border with a black inside, which is what we're having with pulmonary artery. So we can save it. Okay. Any Doppler scans, it's very angle dependent. So I'm just going to freeze this, and right now my angle is at 20 degrees. Now if I take and move this angle to 50 degrees, the only thing that changes is my scale, right? So right now I'm at 48 degrees, and my velocity is, I don't know, somewhere around 800. If I bring this back to where it should be, which is around 20 degrees, my velocity is now at about 600. So be really careful when you're setting your angle. Put it in line with flow, and that's another reason why I always use a color overlay, because that gives me a sense of direction of my velocity. If not, your measurements are off. Beam steering. So if you're looking at a vessel that's more perpendicular to your transducer, we have a beam steering option here where we actually can give you an extra 15 degrees. So you'll actually notice that yellow line is not straight up and down, it's 15 degrees. So instead of 60, we can get to 75. Okay? All right. We're going to go back to our B mode, come back to our short axis image here, and now we're going to do a 4D scan. So we're going to click on this box. I had talked about the stop position. I want to set my stop position first. That way when I set my start position, it's ready to start its scan. So I'm just going to click, there's a 0.00, that is the position of the transducer now. So I'm going to click on that and slide towards the head. I went about 3.5 millimeters. We're going to go a little further. This is our pulmonary artery, so I know I'm all the way at the base of the heart. I've already passed everything. So all I'm going to do now is click on this stop and bring it back to that position. I'm going to click on the position of the motor, which is 5.4, and come back past the middle of the heart all the way down towards, this is actually liver. We're just going to go a little bit further to make sure we capture all of it. This is all liver now. And I'm going to click and drag the start back to that position. You'll notice when I move my start or my stop, this bar moves. That's just setting my scan distance. The only other thing we need to change on here is my step size. My step size will determine how long my scan is. So I can do as small as 40 micron step size. So a better acquisition, a nicer image, but you're going to sacrifice time. We're going to increase our scan to about 200 microns, and that's going to be about 1 minute and 50 seconds. Okay. So once I set that step distance, I'm just going to hit scan. It's moving now, so you can actually see what it's doing is it's taking a series of B mode images throughout the scan distance that we set, and it's going to and they're not images, they're movies. So a B mode movie at each plane, and then it's going to bring them back into a 3D image that we can actually play and watch a beating heart. So MI, right? So when you're actually wanting to look at your infarct size, being able to look at a 3D beating heart, we can actually measure that infarct, things like that. A little more time consuming with analysis. To do standard, sharp, or smooth, I'm just going to do standard. It also gives you the option of doing gating for respiratory gating or comparison gating. So comparison is, it's actually looking at each individual B mode image and lining them up the best it can using AI tools. I'm just going to leave it on respiratory gating for now, just so we're not reprocessing an image. And we're just going to load into 4D. This will just take a minute. And then from here we can slide through the heart. We can actually look at a beating heart in 3D. In any plane that you want to look at. So that was your short axis plane. And there's your long axis. Measurement. So heart rate's really important for a lot of us.
I'm gonna see.
Just counterclockwise. So just grab here and turn.
Oh, manually, okay.
And you'll feel it. It's going to be a little bit of resistance to get it going. There you go. And then when you hit that 0 point, you'll feel it. Keep going. You feel it jumped in, locked in there. So there's your short axis image. So now we're just going to turn your small knob and bring the heart to the middle of the screen.
Where the echo machine will be, right?
It's not where it was. It was in the room over there.
turn the knob down to like.
Okay, good. And then let's turn the big knob a little bit, and you'll see it gets back into plane.
1.8. Hey, look.
Go a little bit further.
We'll save more time.
There you go.
So we
That
should
looks
be,
nice. I'm just
we
going to
might
bring it
have
back to
enough
the
to
middle
last,
for us.
but we'll need to refill that.
Your eyelid, you wrong. I told you. So, there you go. So now we have a nice, this is your aorta here, and this is your apex.
This is the aorta.
Yeah.
Correct. Your aorta is right here, the two white lines right there. Trying to clear out that little bit of the heart attack, but that's okay. I think it's a nice screen that'll give you
Okay.
Perfect. Nice.
So that moves?
Yeah.
No, we're just removing the offset. We're just eliminating that from the display.
Okay.
So we can save that. Perfect. And then if you want, just hit name image. So it's going to save it again, but now you can actually label it. So we're just going to label it. It's called a parasternal long axis. So we'll just do PS for parasternal, and then LAX for long axis. Perfect. I hit that. So now if we go to your study browser, which is the top left corner, yep. Yep, exactly. You'll see your image that you just saved, and then it's here if you wanted to bring it up. But we're just going to hit back. So from here, we're going to turn your transducer back 90 degrees to where you were. Did it block it? Oh, perfect. So now you're going to turn your small knob a little bit. And go a little further. There you go. Perfect. See, your papillary mouse is nice and big right now. So now we're going to go to M mode. Actually, if you want to save this first, hit name image. And this is just a short axis, so SAX. And then just going to click on the dotted part and bring it right to the middle of the heart. If you click on the dotted line, sorry. And then you can slide the whole line over to the right.
Wow, nice.
So we're going to bring it right to the middle. Yeah, right to here. Perfect. And then now you can bring it so that this is out here, outside of the heart, a little further. Perfect. And now I'm just going to move this back a little bit. And then hit start.
Sometimes this is a lucky day. You know, this for me.
Beautiful.
Like sometimes it will fall.
And then you can hit save
like
clip.
300.
One thing that's nice. One thing that's nice about this, it actually has leading impedance checks. So
And everything is just auto.
But it's still doing this. It's nice to work with.
and you can do analysis in lab chart. So if you wanted to,
Oh yeah, eyes are not covered, right? I was
No,
like,
no, no, no.
he's doing it.
Okay.
you can change your display. So right now you have your different options. So
Can you do like analysis on this?
So if you record, and then it's going to record until you stop, you can then get this data and analyze it in lab chart.
In lab chart.
Correct. We can't do analysis on here. And you're going to turn it pretty far. So we're going to bring the animal towards us. We're starting to look for that upside down Y. Start to come in, keep coming.
That's the end.
And this stage is hard to move, so I'm just going to bring this down and then we'll go back. Okay, so now you'll turn your Y knob again. And this is beautiful. So you see this? Go back a little bit the way you were. Perfect. You see this big black spot right here? And a small one here and here? It's like an upside down Y. That's your pulmonary. So if you, and actually you can see your aortic valve right here, opening and closing. If you hit color,
Because everyone has Brazil in there.
and now you can actually see that branch point really well, right? So now you're going to hit pulse wave, or PW, and you're going to put your gate right where you see that yellow. So
I move the whole thing or
Yes.
just
and you're going to move it up a little bit so that it's in this yellow spot up here. Go a little higher. Good, right there, perfect. And I think your angle is good, but if you wanted to change that, you just touch the circle and you can drag it around. Okay, and then hit start. Very nice. And then you can save that.
There's laser sound effects.
Yeah.
You go back to view mode. You want to try 3D?
Let's do
4D?
it.
Okay. Let's turn your Y knob and push the animal away from us. We're going to try counterclockwise.
Kinda.
Okay. Yep.